Do you know what game they're playing, those children? And I'm sure you've played that.
Yeah. They won't let them play it now out on the streets, will they?
No.
I used to.
We know that dementia patients are our most vulnerable inpatients. We know sort of nationally that we don't always get the care right, and we know that there's often dissatisfaction from both the patient and the carers with the quality of the services they get. We also know that people with dementia can expect to have worse outcomes in hospital than we've expected. They'll have a longer length of stay and won't often get to their own residence afterwards. We know that if you get the care right, they do better, they go home quicker.
So in order to help our staff care for patients who have problems with cognition, whether that be because of a dementia or delirium, we introduced the confusion pathway. Now what the confusion pathway does, it helps staff think, right, is this a delirium? What's happening? Is this normal for this patient? What do we need to rule out to find out what is at the bottom of this cognition issue?
We've had each bay colour-coded. We're in the blue bay at the moment, and that goes through the beginning of the bay, at the end of the bay, and everything within the bay is colour-coordinated with the same colour to enable patients to orientate themselves to the ward.
Another part has been the use of coloured toilet seats and grab rails so patients can differentiate and everything is not stark white. We've also included some clocks which have got date and time. When any of us get up in the morning, the first thing we do is look at a clock. So it's very important for our patients when they first wake and there's a visible clock that will tell them the day, the date, the time. This is me is absolutely paramount to how we care for our patients in hospital. What it does, the one big thing it does, it opens up communication with staff and relatives. It helps relieve people's anxiety because we make things more familiar. We can talk about something that is familiar. We know a bit about their background, so we relieve their anxiety. And we know what patient likes and dislikes are.
You know, there's sort of a history that you may not have got from the family before. You know, when patients come into hospital, you don't tend to ask, you know, in the clerkly notes, were you married, or, you know, what did you used to do as a job? Those questions are never asked, and now they are. You know, we can then, as nursing staff, help support the patient in a more person-centred way.
I think there's a lot that's been done, there's a lot to be done, but the sort of feedback we get from satisfied patients and relatives is the thing we're most proud of.
Coordinator's office, Claire speaking.
When patients get diagnosed in the outpatient setting, obviously they go away and they've got a lot of questions that they want to ask the cancer clinical nurse specialists. So really the line was set up to be a point of contact for those patients.
Before the line started, the patients would ring the number that they've got for their key worker, and they'd leave a message because obviously the nurses were in clinic or with other patients, so and then they could be going on annual leave, so the patient wasn't guaranteed a phone call.
However, now having the cancer care line, I know that those patients are able to talk to a live person, a knowledgeable person about cancer, and sometimes just by talking about what their problem is can help relieve some of that anxiety. And they know that by being booked into a clinic, say that afternoon or the following morning, they know that they will speak to a clinical nurse specialist. And they feel safe because they know that they'll be put through to be booked into a clinic appointment, and they know that we will phone them back.
Yes, and I was going to tell you about the This Is Me. And I was going to say to
Well, Joy, I think everybody knows her, will see she's a passionate individual, very passionate about good care, but particularly good care for vulnerable people. And she's somebody that gets things done. She's not afraid to speak her mind, and she's not afraid to comment when care should be better. Very early on, it became clear we had lots of ideas, but not a great sort of capacity to deliver those ideas. So the first thing I tried to do was obviously get a dynamic nursing team to help support and to be a visible leadership towards staff. And I think in terms of an example figure for clinical staff on the ward, I think she sets the right example. She's not frightened of going in there, delivering care, perhaps suggesting how things can be done differently to improve the care for people with dementia.
When I walk on a ward and there's a patient who's confused and very agitated because they're fearful, because they're frightened, and by going over, sitting with that patient, having a chat, and when that patient suddenly becomes more relaxed, much happier, that is just wonderful. I personally feel that if we get it right for dementia patients, we get it right for every patient.